Right now, we would like to get the expert opinion from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. Alex Garza is also Chief Medical Officer for SSM Health, joining us live this afternoon. Dr. Garza, thank you for your time.
Sure.
Well, how concerned are you, and really, how concerned should we all be about those scenes that we saw play out at the Lake of the Ozarks over the holiday weekend?
Yeah, so we are concerned when people aren't taking these things seriously. I mean, we've all experienced the challenges that this pandemic has given to us, both with all of the social, shutdown of the economy, people not being able to go to work. And so it's disturbing when people believe that it's back to normal or there's no risk out there. It really depends on what happens now as far as risk to the general population. I think the governor was right in saying that what we're most concerned about is the more vulnerable population. So the people that don't have a robust immune system, the elderly, people like that. And so it is concerning.
So when could we see a fallout from all this? Is it something that we have to wait a week or two to see what the numbers are?
Yeah, in order to gauge really what the impact of this is. So part of it is we don't know where all those people went to. So some of them probably came back to St. Louis metropolitan area. The timeline usually works out, there's an incubation period and then people become symptomatic and that's when they go and get tested or come to the hospital. So usually 5 to 7 days is a pretty good time frame. But most of the people, at least it appeared to from the video, were probably young and somewhat healthy that were attending these things. And so they could be asymptomatic carriers or they could be mildly symptomatic and never get tested. So it's really difficult to tell when and if we'll see a bump, but it certainly increases the probability of that happening.
So do you anticipate any restrictions in St. Louis City or maybe St. Louis County at some point being putting back into place as a result of events like this?
Well, it certainly doesn't help with reopening the economy or reopening other parts of the economy. And so the challenge that we have then is if we have a lack of social distancing and people not following all of those recommendations, that we will see a rise in the cases. And in order to decrease transmission in the community, sometimes you have to reenact a lot of those shelter-in-place rules and other things to get the transmission back down. And so that's certainly something that we don't want to experience. And a lot of people have put in a lot of effort and have sacrificed a lot to get us to where we are today, and we don't want that to be wasted.
New state data in Missouri shows that the first COVID-19 case could have been as early as February. That would be more than a month before the first cases were publicly announced. Are you surprised by that news? And does it mean the number of cases is perhaps actually much higher than what the state is reporting at this point?
Yeah, not that surprised by it. I think part of the reason why we saw such a rapid increase in cases in St. Louis is that it probably was circulating within the community before we identified that first case. So I wasn't surprised at all with that. We more than we're almost definitely undercounting the number of cases that we have. And so if you remember a couple of weeks ago when we said there was probably around 70,000 cases by the end of April, and that's what we mean. We were not able to test as much as we wanted to, and so there were probably a lot of cases out there that were underreported or unreported, and so there's probably a substantial more people that have either contracted the virus and recovered because of that.
So what is your suggestion, your advice for people who thought they perhaps had COVID-19 symptoms back in January and February? Would you recommend at this point that they get tested for the antibody test?
Well, that's sort of a delicate question, and I'll tell you why. So we're not sure what the prevalence of the disease is in the population, and by that I mean how many people have actually had disease, and so that impacts the test result. If it's not very high, you could test positive, but it's what's called a false positive. And the other one is it doesn't really tell you what your immunity status is, and by that I mean it doesn't tell you if you generate a lot of antibodies or just a little, and so it can't really tell you, how protected you are from the virus because we just don't know enough about the immune response in most people. And so for now, I would say just leave it alone until we get some better data on what the response is from antibodies and how we can figure out what the prevalence is in the community.
Dr. Garza, we always appreciate your time and all of your expert advice and opinions that you pass along. So thank you for being with us this afternoon.